Okay, so we'll start with the speaking session today. Just give a brief introduction about speaking. So, in the speaking section, so it's a face-to-face examination between an interlocutor and you, and your speaking tests, as you know, will be specifically oriented for healthcare professionals. So basically, what you'd get in the speaking section is a patient, and and then you'll be the doctor, and you have to ask the patient certain question that's also given to you. So later I'll show you a role play card. Yeah, so there are some strategies. So before going to the strategies, I would like to show you what a task looks like. So this is the task that you'd get in the exam. So you will get two of these. So in the exam, there are two 5-minute role play sessions. So how it works is, firstly, you have listening, and then you have your exam will be listening, reading, and then you have writing, and then lastly, you have speaking. Um, and when you go inside the room, as in there's a speaking a room where the interlocutor is in front of you, and you'll be given 3 minutes to prepare. And within this 3 minutes, you can jot down whatever you want and what are you going to speak, your, let's say, the order of things that you're going to speak and all of those things. And then you have to speak only for 5 minutes. So you have two role play cards such as this to, get in the exam. So as you can see here, you can see there's a setting. So setting means where you are, at that time. So basically, it could be in the hospital. So it could be inside a GP practice, or it could be, let's say, in an emergency department. And they would give a brief introduction about what your role is. So for example, here they've said a 44-year-old has been referred to your clinic due to high cholesterol and
I just want to
hypertension.
know if he's recording the listen, he's recording it so I can watch it. But I also wanted to show that I'm participating because I paid for this thing.
Hiranya, you are muted. Okay. All right. So basically they will tell you the scenario, and then you have to start your conversation with the patient. So basically here, now you have to act as a doctor, and the patient is a 44-year-old, who is coming to you due to high cholesterol and hypertension. And they've said they're frustrated about the attending today as well. So now you know the patient who's coming to you is 44 years old, and he's coming to you because of high cholesterol and hypertension, and the patient is frustrated. And there are some tasks, as you can see. So the first one here is asking for you to find out what the patient thinks the purpose of the visit is today. And I will give you a brief step-by-step guide later on, so you could use this when you're speaking. But for now, just have a brief understanding about what they are expecting out of you. All right. So, and then so after that, I will be explaining the criteria and all of those things. Okay, so here, and then they're asking you to explain the implications of high blood pressure and cholesterol on current and future health. So they've given examples: strokes, heart attacks, kidney damage. And there's something that you need to keep in mind. It's all right if your medical knowledge is, whatever you're saying in medical terms is wrong, because they're not checking your medical knowledge. What they're checking is your English knowledge, whether what you're speaking is grammatically correct rather than medically correct. Uh, so that means you can say whatever you want to the patient. Don't do that in real practice, but this is an English exam. So you could, say whatever you want to. So if you want to explain any implication of high blood pressure, you can say, let's say, so of course you can die out of high blood pressure, but You get my point. If there is, let's say, a wound, and you could say you can die out of the wound because of infection or something like that. So basically, they don't check your medical knowledge. They check whether what you're saying is grammatically correct. And discuss cholesterol lowering drugs. So this is also a good example. You can say any drug you want, because they're not checking your medical knowledge. So you could say you could take, uh, let's say, I don't want to say, take Panadol for cholesterol because I'm also a doctor. So you could say any type of drugs. That doesn't matter. They're not checking your medical knowledge. And then find out about the patient's lifestyle. So here you see, you have to make the patient also to talk. You can't be just blabbering and just explaining. You have to make the patient also to talk. So you have to, in some other cases, you might have to get their history. So for that, you have to ask brief questions. You have to ask, let's say, for example, let's say their social history, or whether they're smoking, and whether what brought them here. So you have to make them also to talk. So within this 5 minutes, you get marks for making the patient also to talk and gathering information. So that's also something that you have to keep in mind. So find out about patient's lifestyle, example, smoking and drinking habits, and advise the patient on how to improve his or her health. So as you can see, they give you examples on what to speak. All right. So example, if they ask you to talk about myocardial infarction, they will give you example, talk about these things regarding myocardial infarction. Okay, so that's what you would get during the exam and in the exam, and this is way more easier than IELTS, where they're just asking you to randomly speak about a random topic. Okay, so I will walk you through the most important thing. So this is basically the criteria. So this is what they check when you're speaking. So in IELTS, they only check your linguistic criteria. So that is how well you use your English language. But in OET, they check your linguistic criteria as well as your communication criteria. A communication criteria means how well do you speak to a patient, how well do you have a rapport with the patient, how well do you gather information from the patient, and how well do you give information to the patient, and how well are you using layman's terms to explain certain medical conditions to the patient. Okay, so this is very good, not only for the exam, this is good when you're actually practicing in the UK or in another country to use these knowledge. So linguistic criteria, I'll explain these step by step later on, but for now, linguistic criteria: intelligibility, fluency, appropriate of language, resources of grammar and expression. Communication criteria also I'll be explaining later on. So relationship building, how you build a good rapport, a relationship with the patient. Um, um, so I'll tell you how to do that later on. So you get my point. How are you speak? Are you speaking in a very nice way? Are you confident on about what you're speaking? And are you properly, are you approaching the patient in a very non-judgmental way? Everything, all of those things comes under relationship building. And understanding and incorporating the patient's perspective. That means, now let's say now you are giving the patient a certain kind of treatment and the patient doesn't like it. But in Sri Lanka or many Asian countries, they would be like, no, you have to take this and there's no other option. But what they're expecting is you have to understand why the patient doesn't want to take it, and you should be understanding, and you should be able to change it. And you should give the patient other options to consider. And that is, so during your role play, if the interlocutor says, I don't want to, follow whatever you're saying, you have to understand that, and you have to understand the patient's perspective and why the patient is saying that, and you have to play along. But if whatever you're saying cannot be changed, then you have to explain that in a very empathetic way or in a very kind way to the patient, saying that you can't change, we can't change it because this is the only drug that you should take. And another important thing is providing a structure to the patient, because you can't be going all over the place. And because this is a consultation and you're a doctor and the patient is coming to meet you to get advice. So you can't be lost. You have to carry the conversation and you have to take the patient with you um, in this conversation. So in order to do that, you need to provide a clear structure to the patient so the patient would understand whatever you're saying. So that would look like when you're initiating the conversation, you should tell the patient, okay, I'm going to first talk about so first I'm going to ask you certain questions about your condition, and then I'm going to uh, let you speak, or I'm going to give you a management plan or the treatment plan. So now the patient knows. First, the doctor is going to ask me some questions regarding my uh, condition, and then he will give me a management plan. So they, before the conversation begins, the patient has an idea about what's going to happen. So that's basically providing a structure. So that's just a brief example. So according to your cue card, you need to prepare your structure and tell the patient this is what's going to happen today in the consultation before before you start it. Yeah. So this is very important. And you get marks. You get 3 marks for just giving or just telling the patient what you'd be speaking. Okay. And then another thing is information gathering. Information gathering is, you asking the patient, for example, if the patient is coming with pain, you can use Socrates method. You can ask that site onset characteristic, whether it radiates, elevating factors. So you can ask all those things. You can play around with whatever, your medical knowledge as well. And although you won't get marks for showing off your medical knowledge, but the assessor would give you marks under information gathering. So that means if the patient, let's say, coming with a chest pain, and if you want to ask the site and all those other relatable questions, you could do that. So basically, whatever you learned in the medical school, you can use it during the exam as well. And you get marks for that by just getting the information. So as you can see, you have to make the patient talk also. You can't be just blabbering and just talking and not letting the patient talk about his or her concerns. And then information giving is also very important. This you have to always understand you're talking to a patient who has no idea about medical knowledge. So you can't be using terms as hypertension, diabetes, myocardial infarction. You have to use always high blood pressure, high blood glucose levels, and heart attacks. So similarly, you have to use layman's terms when you are giving information to the patient. And when you're giving information, for example, you're explaining this patient about, let's say, heart attacks, and you want to explain this patient how it happens. And what a small strategy or small tip that we use is the chunking method. That is where you explain bits and bit by bit to the patient, and you're asking whether the patient understood. So basically you explain a little bit, and then you ask the patient, did you understand? And the patient said yes. Then you proceed, and then bits by bits you explain. So that's a good way. That's how that's not only used for this OET, that's used by doctors and consultants to explain certain things to patients so they understand better, and then the patient retains it rather than you just blabbering, because the attention span might be a little bit low, and they might just forget or not follow you. So always use the chunking method where you are explaining bits by bits, and you're asking whether they understood to that point. And if they didn't understand, you have to repeat that again in another way. I hope you understand what I'm saying. Okay, so that's the whole criteria. So this is the foundation in speaking. And as long as you understand these things, you don't have to worry about anything during speaking. And I could assure you that it's way more easier than IELTS, because these are things that you have some kind of a knowledge about. Because I did IELTS as well, and when I went to do my speaking, they asked me to explain, to talk about water, or talk about trees or something. And I'm like, what is there to talk about water? And so that's so in this case, you have something to talk about, and you can imagine a situation where you are with the patient, and you can, speak um, to the patient regarding these diseases that you've actually learned. Okay. All right. So I just want to give a brief introduction or a brief idea about what intelligibility is. So intelligibility refers to the extent to which the speech or language is understood by others. So basically, when you're speaking, you can't be speaking like this where nobody understands or nobody can hear. All right, so you have to be very loud and very clear when you're speaking. And intelligibility also, it involves your pronunciation, your articulation, and your grammar, your vocabulary, and overall clarity in conveying your idea to somebody else. So this is not only used in OET, it's used in day-to-day life as well. When you're speaking to somebody, you have to be confident, and you have to use your voice in a way to, to give that idea what you think, you know, in an understanding way to the other person. Is this recording? Yeah. All right. So intelligibility is that how well does the patient understands you when you're speaking. So that involves your pronunciation, your vocabulary, your grammar, and your clarity when you're speaking. Okay, and this involves your intonation. So when you're speaking, you can't be speaking in the same pattern like this. You have to vary your pitch. So there should be places where you increase your increase your pitch, and there should be areas where you decrease your pitch. So it involves variations in the pitch of your voice when speaking. So always remember, you can't, you know, not you can't, do not or avoid speaking in a very monotonous way. Always try to change your tone when you're speaking. So for example, when you're asking a question, the tone is different. And when you're assertive, your tone is different. And so whatever you want to be with the patient, for example, if you're explaining something, your tone should be different. And if you want to, let's say, explain something which is very important, your tone should be different. And when you're being empathetic, your tone is different. So so different emotional states have different tones. So you have to be mindful when you're speaking what kind of a tone that you're using when you're communicating with the patient. Okay, so under intelligibility, this carries 6 marks. So when you're speaking, like I said, always use your voice, and use your voice in a way that you're varying your tone, and to increase the clarity of your ideas. Yeah. So in English and many other languages, intonation patterns can signal the intention behind a statement. For example, rising intonation at the end of a sentence indicates a question. So these are things that you and I, almost do day to day, in day-to-day life. And but when it comes to the exam, certain people forget it. But when you're casually talking with somebody, you have that rising intonation when you're speaking. But when it comes to the exam, people become anxious. They become very scared. And because of that, they forget about this intonation. They just, they just go like a train, and there's no, it's very monotonous. So those are certain places where you would, miss a lot of marks, just careless mistakes. So as long as you don't, as long as you're aware of those things, you don't have to worry about it. Yeah. So here I was talking about rising intonation often indicates a question, while falling intonation typically signifies a statement. So intonation can also convey excitement, surprise, sarcasm, or other emotional states. Okay, so I mean, you know how to differentiate certain kind of intonations, but during the exam, only a little bit is necessary. For example, how to be empathetic and how to use your tone to be empathetic, how to use your tone to ask a question, and statement to be assertive, and when you're explaining. So I've sent you in the group um, certain things, certain examples that what you could use. For example, to be to show empathy, how to start a statement, and when you're giving an advice to the patient, how to start a uh, statement or how to start a sentence. So just go through that and might just practice at home or practice with your friends. And for those who have exams next week, I might have an extra class for you guys, and I will do a couple of role play sessions and before you go to the exam, so you have an idea before going to the exam. Okay. All right. The next one, I hope everybody's there and nobody's sleeping. And if you're feeling bored, just let me know. I would just go fast. Okay, so influency is how your speech is delivered in terms of rate. Okay, so you can't be speaking so fast because you can make mistakes, or you can't speak super slow like this, because then they can't. The assessor will you might lose marks under influency, under what am I saying? Fluency. Um, okay, so tips. Speak at a natural speed. If your speech is too slow, the listener might feel frustrated. I hope you guys are not feeling frustrated. Um, yeah, so yeah, waiting for you to finish or may lose the flow of the argument. Similarly, if the speed is too fast, it might be difficult for the listener to comprehend. So if I ask a question, where am I? Am I too slow? Am I too fast? Are you feeling frustrated, or are you trying to comprehend what I'm trying to say? Any answers? I hope the silence is not frustration. Any answers? What about Dr. Lorena?
Sorry, Dr. Harindu, I didn't get your question.
No, I was just asking where, the fluency, where am I? Am I too fast or am I too slow? What do you think?
I think it's moderate, not too fast, not so slow.
All right, so you're not frustrated, or you're not trying to comprehend what I'm trying to say. You understand everything, right?
Yes.
All right, great. If there's any questions, you can ask me. So basically, that's the fluency. And yeah, so pauses contribute to an improved understanding. Therefore, use pauses effectively in your speaking. Aim for even speech, not broken up fragments, and reduce excessive hesitations. So when you're speaking with the patient, don't ever reduce your ums and and saying and all of those things. Stop thinking. You have to be clear. Your clarity, because when you use ums and ahs in between your sentence, it affects your clarity and affects your fluency as well. So when you're speaking, I've seen a lot of cases like this with the students. They would take a lot of time to speak, and half of the sentence is it consists of a lot of ums and uhs. So try your best to reduce any hesitations and self corrections and all of this, all of those things. Okay, and then appropriateness of language, which includes including the use of suitable professional language and the ability to explain in simple terms as necessary and appropriately, given the role play. So you've been you are assessed if you're using formal if you're using professional language, you get 6 marks. All right, so that's under appropriateness of language. And the last one is not here. It's the grammar. So everybody knows the grammar should be correct and there shouldn't be any grammar mistakes. Okay, and then we come to communication criteria, like I said. So under relationship building, so this is all the so I'm talking about the criteria here. So I just finished the linguistic criteria. Now I'm talking about the communication criteria. So the first one under communication criteria is relationship building, and that we have 4 sub criteria under that. So initiating the interaction appropriately, for example, welcoming the patient. For example, hello, good morning. I'm Dr. Harindu. How can I help you today? So that's initiating the role play appropriately. And the way you initiate the role play actually says, or actually gives an understanding to the patient how good how do you say that, how good of a doctor are you when welcoming the patient. So greeting your patient in a friendly and a confident and a welcoming manner, you have to establish rapport. So you have to demonstrate an attentive and respectful attitude as well when you're speaking. And you have to adopt a non-judgmental approach. So you have to be acceptable or accepting and respectful for whatever the patient is saying. And you have to show empathy for feelings and emotional states and all of those things the patient or the interlocutor is telling you. You have to be very empathetic. And so how do you show your empathy is by your tone. And I will be talking about those things a little bit later on when we are doing the role play sessions. Okay. And then, like I said, providing structure is also very important. So, like I said, sequencing the interview purposefully and logically, and you have to control the direction of the conversation, and sequencing the conversation logically is so this is so basically, like I said, you have to tell the patient what is going on in your conversation. And you can't be talking about the same thing again and again and again. You have to tell the patient, okay, now we finished this. Can I move on to the treatment or the management plan? Is it okay? So you have to always ask the patient whether it's all right to move on to the next, the next point. So if the patient says, no, I didn't understand what you said earlier, then you'll have to explain that again. And this chunking method, like I said, breaking down the information into chunks and giving it to the patient in small increments and allowing them to absorb each block of information. So I think I explained this before. You have to always, when you're explaining something, you have to always explain it in, chunks. You have to explain a little bit and then ask whether the patient understood and then move on. Okay, so that's providing structure. Okay, so I told you that I would give a step-by-step guide to tackle speaking. So now you have an understanding, a brief understanding about the criteria. Now, how do you put this into practice? Okay, so so the first thing is you have to introduce yourself. That's the step 1. When you get the role play, when you get the cue card, you're given 3 minutes to prepare. So within these 3 minutes, you have to put, put all of those things into these steps, all of what's in the cue card into these steps. And this will help you to speak in a proper structure. Okay. So the first step is introducing yourself and your role in a confident and a friendly manner. And it helps in establishing a rapport with the patient. But at times, your cue card may suggest that you already know the patient. So basically, now, before you saw, the setting was at a GP practice, before in the in the previous slide. But it could be in a hospital ward as well. So if it's in a hospital ward, you already know the patient. Maybe, or it could be the patient's follow-up. You're in the GP clinic and they would say that the patient is following up. So you already know the patient. So if you already know the patient, there's no point introducing, hello, my name is Dr. Harindu. How are you today? How can I help you with, or can I know your name, please? You don't have to do all of those things. You can directly ask close questions. So I'll come into that later. Or you can directly say, hi, with the name, because you already know the name, and then initiate whatever the questions that you want to ask. Okay. But in this case, you don't know the patient. So when you don't know the patient, the first step would be introduction. So an introduction would not be necessary if you know the patient. So if you don't know, you could say something like, hello, my name is, you could say your name and you can say, I will be your attending doctor today. That's you introducing yourself. Or you could say, I'm one of the doctors in this facility, or you could say, I will be looking after you today. And then in the step one, so the next step under step one would be asking the patient's name. So you could ask, can you give me your name, please? So these are the basic steps that you would do anyways when you are working in a hospital. So you have to implement the same thing during this exam as well. So next step would be asking the patient's name. So note, in some cases, you may already know the patient. For instance, when the patient is returning for a follow-up visit or has been admitted to the hospital ward, in those cases, an introduction may not be necessary. During the preparation time, you could ask the interlocutor what he or she would be preferred to be called and begin the role play. For example, you can directly say their name. Like I said before, you say, good morning, David. How are you feeling today? And how are you doing today? Or you could say, may I confirm your details? Please confirm your first name and last name for me. You could say this if the setting is in a hospital. Okay, are you all with me still? Okay. So step two is using you have to use the background information to understand what you already know about the patient's current situation and use this to formulate the initial question or statement. In other words, the opening statement of question should match the background information on the cue card. So for instance, if you're meeting the patient for the first time, use the following open-ended questions. So basically now you finished the whole introduction, and now you need to know why the patient is here. But in the role play card, they might already so in the role play card, it might have been it might have been mentioned, but it's always good to make it realistic. So it's always okay to ask the patient why you are here. So you could ask. So this is an open-ended question. What brings you here today? So then the patient will explain everything, why the patient is here and all of those things. Okay. So if you already know the patient, you ask close-ended questions. So use a close-ended question when you already know the reason for the patient's visit, or if it's a follow-up visit. So you could ask something like, is there anything in particular that prompted your visit today, or is everything going well since your last appointment? Yeah, so these are close-ended questions where, where the patient, when you already know the patient. So the next step would be complete. So now when you go to the tasks that's given into the cue card, once you finish your step one and step two, now you have to plan the execution of the role play depending on the task mentioned in the cue card. So signposting could be useful to explain the schedule or sequence of the task. Since you are responsible for initiating the role play, these expressions will be helpful in structuring the role play. So do not forget to obtain the patient's agreement while doing this. So now you introduce yourself. Now you ask the patient why the patient is here. Now the patient explain, now I'm here because I have a pain in my chest and it has been going on since yesterday. And I'm so worried about it. I just came here to know whether it has whether it is serious or not. So that's something the patient would tell you. So when the patient is explaining something that is worrying the patient, you have to always be empathetic, and you have to say, um, I understand. So let's start. So let me first start with asking you some questions, and then we would talk about the management later on. Or you could say, shall we start with whatever you want to say, and then we will discuss the treatment options. Or you could say, before proceeding further, I would like to ask you some questions to get a detailed picture of your situation. Would that be okay? So these are certain things that you need to ask the patient before just jumping in, let's say, the treatment, or jumping into the whatever the diagnosis or whatever that's mentioned in the cue card. You have to tell the patient, or you have to ask the patient, okay, I'm going to first explain to you what, my, or whatever it's said in the role play. Let's say it's a heart attack. Let's say, before proceeding further, I would like to talk to you. I would like to ask you more questions or more information regarding your chest pain. Then you gather information. You're asking the site, onset, and all of those things, and then um, you can explain the diagnosis. Before explaining, you have to tell the patient. You have to ask the patient, okay, let's say, David, I have gathered all the information that I need, and I would like to explain my differentials with you. Is that all right? So David would say, yes, that's okay. And then you can say there's a possibility of it could be muscular pain, or it could be related to gastrointestinal disease, or it could be, this could be heart related as well, or it could be lungs related. So whatever you learned in medical school, you can say, or it doesn't matter whatever you say, but you're telling the patient that these are the possible causes of your pain. And then the patient would be like, oh, okay, I understand. And then you can proceed further. This is what we are going to do next. We are going to do some investigations, and then we are going to, then I'm going to prescribe you some medications, and then this is what's going to happen later on. So according to the cue card, you tell the patient what is going to happen next. So always be mindful and conscious when you are speaking, because they check this, very well. So as long as you give a proper guidance or a proper structure in your conversation, you're good to go. So step 4 is completing the task. Like I said, and the cue card, before going into the task, you have to tell what are you planning to talk about. And when you're going to each and every task, you have to tell the patient what you'll be talking next. For example, now, when initially you said, I'm going to talk these and these, these things. And when you are talking all of those things, don't just talk without asking patient something. So when you're going to the next point, always ask, okay, now I'm going to talk about the treatment plan, like I said before. Is that okay? So then the patient will say, yes, that's okay. So always, when you're speaking and when you're transitioning into the next point, you always tell the patient, I'm transitioning. Is that okay if I talk to you about this now? So always remember, so those are small points that you could use during your conversation, and that would, increase your marks. Okay. So step 4 is conclusion. So always remember, you have to conclude your role play. Don't just leave the patient hanging. So there are certain ways that you could conclude. You can either briefly summarize what you discussed with the patient, or you could tell the patient what's going to happen next, whether you are going to see him or her after 2 or 3 weeks, or is there any investigations that's going to happen next. So those things, those are the 2 conclusions that you could, tell the patient. But if you want to be creative and conclude in a different way, you could do that. So basically, as long as you conclude at the end of the conversation, that's fine. Okay. So that's the guide. So that's what I've summarized all of these things that you will get in the OET exam. into these 4 steps, as in what's expected out of you in the OET exam, into 4 steps. As long as you do those things very well, and as long as you practice. So I've sent 50 role play cards on the so I've sent it on the group. So what you guys need to do is practice with your friends. Tell your friend to be the interlocutor, and you be the doctor, and tell the friend, to act as a patient. Okay, and there's some strategies I would like to share. So I've already told these things. I will tell you all again. So treat the role play as if you were with a real patient. Allow time to establish a relationship with the patient and ask for relevant information. And remember that the assessor is testing your ability to communicate effectively with patients in English. And they're not testing, give me a minute. Yeah. And they're not testing your medical knowledge. Like I said, always pay attention to the type of information you need to communicate to the patient and adjust the way you communicate this information for different situations. If the patient is being given bad news, for example, you should show empathy and kindness. And don't ever memorize long answers. Anything that's just things that has been memorized will not be assessed. And use variety of vocabulary, which matches the need of the patient and context of role play. You need to show you can communicate with the patient in a variety of ways. And you have to always speak loudly, clearly, and confidently so the interlocutor can hear you. Pronunciation is also very important. And this intonation is also very important, like I explained before. Your voice should rise and fall as a native speaker's. Read the role play card carefully so you do not misunderstand or miss out on any of the topic or bullet points. Make brief notes. So you have 3 minutes. You have the role play card. You can do whatever you want to within those 3 minutes. And so make small notes and have a proper structure, and keep that in mind. And it's just 5 minutes. So what are you going to do within that 5 minutes? Just write it down on that piece of paper and be ready when the 5 minutes starts. And don't be nervous. So this is something that most people go wrong. They do very well and they go there and they become nervous, and I don't know why. And you're given a patient and you're a doctor. You can't be nervous in front of a patient. So you have to take a deep breath, smile, and make eye contact as you begin your speaking test. So if you are feeling nervous, it's a normal thing. Always think that you're in a hospital and the interlocutor is the patient. So he is the patient, but you have to see it like that. If you don't see it like that, if you see this as an exam, you might feel a little bit anxious. So if you're feeling a little bit anxious, you can always tell yourself that this is a patient. I'm just going to treat the patient and just finish it off. So underline keywords and phrases on the card to assist you with the role play, and don't be afraid to ask the interlocutor to clarify anything on the role play card. So if you don't understand anything, you can ask the interlocutor the meaning of certain words. And yeah, so all those things. For example, you can tell the interlocutor before beginning the role play card that you would be calling the interlocutor this certain name. So then when you start, you can directly start. So this is when you already know the patient. You can directly start, "Hello, David, how are you today?" So the interlocutor will play along. Okay, or you can, within those 3 minutes, you can tell the interlocutor that you will be calling the interlocutor David when the role play starts. Okay, so that's speaking for you. And so this is speaking, so I want everybody to speak. But unfortunately, we don't have much people today. So what I would do is